Today, we are talking about post-traumatic stress and how it affects first responders. Hi, I'm Dr. B, and I want you to fully enjoy life and experience the freedom that God desires for you and those around you. Post-traumatic stress is considered a mental health condition that seems to be caused by a distressing and terrorizing event, either experienced yourself or you witnessed the incident. As I shared in the last video, you can experience or witness a traumatic event and then have a difficult time coping in life. What we've learned is that with time and self-care, you can usually get better. But if your symptoms continue to get worse, say lasting for several months or even years, you may have post-traumatic stress disorder. If you cannot get through your day-to-day living, you will need help. The question is, how common is post-traumatic stress in first responders? Here's what I've learned through the years serving as a fire and police chaplain. The nature of the job as a first responder is so stressful. Many are diagnosed with symptoms of PTSD. When I served as a fire chaplain, I decided to go back to school and get my EMT certification for the state of Florida, which I did. So while serving with the fire department and having my certification, I was part of the crew when I rode on the fire trucks with the firefighters. I was able to work under paramedics doing CPR and handing medications to the medics. But I still have some memories that have affected me personally, and I feel I can speak clearly about first responders and PTSD. There was one call that I did CPR on a lady brought out from a house in a fire, and we were in the back of an ambulance for 20 minutes on the way to the hospital. The whole time I was doing CPR. The paramedic was intubating while I did CPR. When we arrived at the hospital, we turned the care over to the ER doctor. And I remember the feeling of excitement when the ER doctor said, "We have a pulse." And then about an hour later, we were told she died in a helicopter on the way to the burn unit in Orlando. The feelings of distress came over me after hearing that news. Now, what I realized in that moment is that first responders deal with these emotions almost on a daily basis, and it does affect you if not dealt with properly. When working with first responders as a chaplain, but also a counselor, there seems to be at least 5 most common causes of PTSD in first responders. The first one would be trauma affecting children. As I've worked through the years with first responders as I counsel, one of my first questions is, tell me about the worst day you've ever had on the job. They almost commonly share a story about a call that involved a child. First responders normally go into a career to protect citizens. Most report that their stress level is very high when they go to a scene where a child is either injured or, sad to say, killed. When you think about it, children are innocent, and when they suffer or die, a very stressful time is during that call. Now, many can handle the call because they follow their training, but what happens later is when they start experiencing the symptoms of PTSD. I still have memories of my first call out concerning a child. I was a pastor in Missouri, and I received a call to go to the hospital. When I arrived, one of my church members' 11-year-old sons had stayed home from school, wrote out a note, took his dad's Walther PPK, and shot himself in the head. He still had a pulse, but it was clear he was not going to make it. They put him on a helicopter and transported him to a trauma center about 30 miles away. The ER doctor, who was a friend, asked me to take mom and dad to the new location in my car and asked them to consider signing a document to harvest organs for others. I'll be honest, that was the most difficult 30-minute ride of my life. I ended up staying with the family for a few days to help them through the difficulty I even performed the funeral. And I've had other calls concerning children, but this was my first one, which still affects me. Now, when I talk and counsel with first responders, many of them have story after story like the one I just shared. For many like me, these types of calls can haunt the first responder for their entire careers. While counseling, I help them file their stories in their brain and control the thoughts about the event. A second would be chronic fatigue. And lack of sleep is another common cause of PTSD in first responders. For firefighters and EMS workers, they normally work 24-hour shifts every 3 days. My daughter is a firefighter paramedic on the East Coast in Florida. And she shares with me about how lack of sleep contributes to problems she and her workmates face. Some even do double shifts and miss 2 nights of sleep. And this is not good for the health and pushes the first responder, who especially needs sleep due to the difficult calls they make. A third would be fatality car accidents. They can cause trauma with the first responders who make those calls. Car accidents that cause death can be exceedingly gruesome. I've seen some particularly bad accidents that I don't even like to talk about. For many first responders, they deal with fatality car accidents quite a bit. The scenes can create nightmares and many triggers that can cause emotional pain. And then fourth, I would say compassion fatigue. It's another event that can happen with first responders. Many become first responders, like I said, to help others. And many start out with a heart to be there for people who are hurting. And many will not only have firsthand experience, but also listening to vivid accounts of an event by witnesses. Then 5, which is the big one, cumulative events. It's probably the biggest theory of first responders and PTSD. There seems to be effects of events over a long period of time. You see, instead of a few isolated incidents, first responders deal with numerous trauma over their career. You know, after counseling with many first responders, it seems that about 7 years is the marker for those who struggle the most as first responders. What happens is these calls and events can build up in a person's mind and emotions over time, eventually, if not dealt with properly, become overwhelming. What I have observed is that most first responders don't consider the cumulative events over time. Many first responders do not get mental health checkups because it's seen as a sign of weakness. So normally they will not be found out until they show signs and symptoms of PTSD by their spouses or those they work with. What is sad to me is knowing that behind every first responder who is dealing with trauma, there's like this invisible family left to watch helplessly and pick up the pieces when the responder begins to act out due to stress and anxiety from the job. Now, here are some signs and symptoms you need to know if you're a family member of a first responder. Here's a list of symptoms that may be seen in first responders that may be struggling with PTSD. Losing interest in previously enjoyed activities. If your spouse just stays home all the time, except when they are working, take notice. Distancing themselves. Many struggling with PTSD do not want to be social, so they stay away from others. Being on edge or feeling tense all the time is another symptom. Difficult time sleeping. Many have trouble getting enough sleep due to the long working hours. Those suffering from PTSD even have a tough time sleeping because their mind will not shut up about the trauma they've witnessed. I think a big one you may have noticed is irritability or aggressive outburst, even concerning small things like a child making noise or playing. Increased drug or alcohol abuse is another symptom that first responders trying to cope with their feelings. I remember as a chaplain of a firefighter who had a 2-year-old die in his arms. Later that night, I received a call to go to the firefighter's house, who was in his driveway crying uncontrollably. He had drank a fifth of Jack Daniels and could not control his emotions. You see, many will experience flashbacks and dreams and intrusive memories about a specific trauma. Some will totally avoid talking about an event and even avoid the location the trauma took place. Some will begin to show risky behavior and maybe even dangerous and self-destructive acts. If they get to the point of hopelessness or paranoia or fear, it's time to get help. Some will get to the point where they cannot focus or even miss many days at work. You know, I have for years encouraged first responders to watch out for each other and help their co-workers. No one understands the job of a first responder like another first responder. Please monitor your co-workers, especially if you see any behavior changes. Don't tell them to just suck it up, but encourage them to get counseling. Left unchecked, PTSD and symptoms can go on for years. As a counselor, I've seen first responders who have come to me after too many problems have manifest in their lives. I've seen major problems like medical issues, family problems, domestic violence, violent mood swings, substance abuse, and sad to say, death by suicide. If you are a first responder and some of these issues have caught your attention and you feel you're experiencing symptoms of PTSD, let me suggest you find a counselor or therapist trained in PTSD or background as a first responder. Reach out and talk to others going through what you are experiencing. Now, honestly, the hardest part about getting the help you need is sharing you need help. Let me suggest you turn to God and ask Him to guide you through your life. Hey, thank you so much for watching this video. If it was helpful, be sure to hit the thumbs up button. Also, be sure to subscribe and click the bell icon so you will always know when we post new content. Have a wonderful day as you continue finding freedom in your life.